and turning to this session, first of all, can I just thank Guinness Partnership and Guinness Care and Support for their sponsorship and their support for this session. It's entitled The Future of Housing with Care. Every decision about care is a decision about housing. And in fact, Stephen, those words will be very familiar, I'm sure, to you, as it's something that ADAS very much explicitly stated as part of your statements around the importance of housing with care. The next slide is very much about which sets out our programme for this afternoon. And I'm delighted that we are joined by 5 fantastic speakers. Stephen Chandler, who's President of ADAS, but also Executive Director of Adult Social Care of Oxfordshire County Council, will join us in a minute. He will be followed by Catherine Smith, CEO of the Social Care Institute for Excellence, who published a recent report funded by Dunhill on the Commission of Housing with Care. Delighted that Una's going to join us, but she's actually be jumped by Jackie Sears-Marshall, who's the director of Jackie's Revolution. I'm afraid Jackie's going to leave slightly early, so thanks Una for stepping back one place. Una Goldsworthy, who's the chief executive of Brunel Care in Bristol, and last but not least, Professor John Glasby, who's the director of the new Impact programme at the University of Birmingham. The title of this session, The Future of Housing with Care, Every Decision About Care is a Decision About Housing, is really apt and timely, bearing in mind it follows so hot on the heels of the Social Care White Paper last week. So without further ado, I'm going to pass over to Stephen. So Stephen, thanks very much for making time available to join us this afternoon.
Thank you, Jeremy. And if you could put my slides up, Sally, that would be great. I'm really pleased to be able to come along this afternoon and engage in this conversation because, as you said in your introduction, for us in ADAS, any decision about care has to be a decision about housing, and to engage with such a broad audience for me is really, really important. Just one thing, I tend to drop it off of my title because I need a badge as long as your arm, but I'm also the Director of Housing Services at Cherwell District, so it gives me a helpful insight into the opportunities and challenges of housing from a local authority point of view. So if we could just move on to the next slide. So let's just for a moment pause. Really think about each and every one of us and the lives we live, and just think about what is it we want as we live those lives. And I would put a challenge out to the audience and the broader audience that really what we want is to be as independent as possible with the ability to realize our full potential. Now, each and every one of us has different potential, but what we want is the ability to be able to realize that. We also want to, and I certainly know that as I get older and think about the impact of old age, never mind illness, etc., I want to continue to have choice. I want to continue to have control, and I want the necessary support to continue to help me live that independent lives. And let me be very clear with you, I want it in that order. So I want to remain in control of the choice, I want to remain in control, and I want the support to fit around that. Of course, support the care I need, we all might need. I want it to be good quality, and I want to have a diverse range of options of that support available to me. So you could apply that to all of our lives each and every day, not just our lives if we happen to be in contact with social care. But from an adult social care system, I want to ensure that that system is fair, it's accessible, and it's proportionate. And of course, it has to be sustainable. We'll probably hear in some of the questions some challenges around how we afford all of this. And of course, if you're like me, you won't want that promised to you in 20 years or 30 years. You'll want that now. So I want all of those things now. And if my life should change tomorrow, or my family's life should change tomorrow by illness, long-term condition, accident, I want all of those things today. So that's the challenge for all of us. So just move on to the next slide. I'm just going to quickly reference a few notable organizations that have passed comment on social care. So hopefully the majority of you will have heard of Social Care Futures, which is very much a movement of people who are either in receipt of some form of support or are supporting people who need support. And what they've been saying quite rightly is that the social care system as it currently is, including the housing element of it or the accommodation element of it, is broken. So we need a different future. And if you look at if you can see the bottom of that slide, we all want to live in a place we call home, with the people and things that we love, in communities that look out for one another, doing the things that matter to us. So again, control, choice, flexibility, all of those things. And we want to stop what I would probably describe as the negative narrative around social care. Social care is not a drain on British society. Social care is an opportunity to invest in British society. We don't say to ourselves, oh, bloody hell, why have we got all those children needing education? You know, we see education as an investment in our future. We should see exactly the same in relation to social care, both the people who need support and certainly the people who are employed in providing that support. So if you move on to the next slide for me, please. So I'm not going to say very much about this because no doubt Catherine will cover it, but fantastic report published last month. Again, a place we call home, which provides a very clear vision and roadmap for future options. So I hope you're starting to see that the good news is we don't need to do a lot of work to describe what the future looks like because it's been done. The pictures are out there, the accounts, and indeed in some instances, a lot of examples of that. So we can draw upon that. So next slide, please. And Jeremy referenced this, and it would have been a travesty if I didn't refer to the white paper published last week. Of course, the white paper has a lot of things in it, but it did have reference to housing and the future of housing. We haven't yet seen the detail of what this means, but there's a clear commitment to 300 million to integrate housing into strategies. A focus on increasing, as you can see, the range of supported housing. Interesting that because this government through the pandemic has often appeared to focus very much on care homes, understandably in one sense, but social care is not just about care homes. And in fact, the majority of people are supported outside of a care home environment. But everybody needs somewhere to live. So it was really great for me to see in the white paper reference to housing. I've put both, you might say, gosh, Stephen, was that all was in the white paper about housing? Well, those are the two specific references to it about helping people remain in their homes as their disability or age frailties impact upon their independence. What I liked about the white paper was the values that it set out right at the beginning, which were very much in line with what I referred to in my opening slide: choice and control, independence, good quality support, and a fair and equitable system. Now, there will be, and in fact, in other audiences, I will be one of those people saying the money's not enough. The money can't be enough to do what we need. And I'll be very clear, I don't believe it is. However, what this money should allow us to do is to demonstrate very clearly to Treasury in the main, because they seem to be the government department that needs convincing, that there are alternative models of support that deliver better outcomes, better choice, promote independence far better, and are much more cost effective, so that the investment that is needed to make housing with support a reality for everyone who wants it is available. So I see the white paper as providing, I think I said it last week, that stepping stone, that foundation block, but certainly not the end point. Of course, it's good that it's a 10-year white paper, so therefore it talks about the future in a timeline that takes us beyond the committed resources in this Parliament, because again, that allows us to stop thinking about just what we've been told is available, and we should not limit our ambitions in relation to that. So if you just move on to the next slide, conscious of time. And then finally, just again, if you needed any convincing around the importance of housing with support, I know Michael not very well, but I'm very impressed by him. With the cabinet reshuffle recently, he talked about Mr. Gove and needing to draw upon his reforming instincts, because let's be very clear, it is going to be a challenge to develop and decommission some of those old models of care that are no longer needed. So it is a radical change in delivery that's needed. And I'll, in my next slide, talk about some of the challenges I think we face in that. You can see there in the final sentence that the ask that the Secretary of State makes clear his commitment to increasing that provision, housing with care. If you didn't think housing with care was important, let me be very clear. It absolutely is. It should be the cornerstone of housing support as we move forward. So next slide, please. And you'll be pleased to know this is my penultimate one. So every decision about care, and of course, it's not just people like me and my staff that make those decisions with people. It's often families who are responsible for funding their own care that do that. So I think some of the challenges we're facing is how do we ensure that we continue to promote even greater that independence, that choice and control that people want, so that I can remain in my home for as long as possible, or that I have the conversation around how, as my health and age related needs change, that my accommodation changes alongside that. We need to break the mold that we're in currently, the dependency on what I would describe as outdated models of care for a lot of people, namely residential and nursing care. There is a place for residential and nursing care, but it is for far fewer people than are currently offered and accommodated in that model. So there is a real need to break that mold. That's not a mold just with social workers or commissioners, it's a mold with families, it's a mold with society, it's a mold with politicians. We need help and support to lever change, the change that's absolutely needed if we're going to deliver the type of support that you and I want. And of course, with all change, there's an issue about managing risk. How many times do I have a conversation with a family member who's worried about mum or dad or their young disabled son or daughter and the risks that they might experience, and how independence brings with it risk. So there is a whole issue about how we have a much more aspirational conversation around our citizens, irrespective of their age, their disability, their health need. And of course, the culture that exists at every level, from government, from society, from organization, right through to practice, needs to develop and change. So I hope you've picked up the sneaky approach I've taken there. So for every challenge, I saw an opportunity. And I do think for us, it is really important that we embrace all of our challenges as opportunities. If you can't work out, I don't know how big people's screens are, but that slightly rotund gentleman on the left is actually me on one of the sites we went to when we were building a massive housing with care and support facility in Didcot. My cabinet member and the local community member there, and we were really excited about this. We were really excited about bringing something to the community, not taking something from the community. And I think for us, it's about making sure that that narrative comes through. So just finish with my final slide. There are a lot of very important people, not just in this panel, but certainly in this audience. And we will only deliver this vision, whether it's a white paper vision, a SCIE vision, a social care futures vision, if we believe that the impossible can be done. Not that it can be done, but it absolutely will be done. So thank you for your time. I'm looking forward to engaging the conversations. I'll hand back now to either Jeremy or Catherine.
Thanks very much, Stephen, and you've certainly demonstrated the art of the possible, and you say let's make that possible as well. So thanks very much for your opening remarks, and it very much fits in tune, but not just with what you've been saying, but I see in the chat box and the Q&A you've already sort of enabled people to sort of make some comments. So please do have a look, and we'll come back to those later on this afternoon. But as you say, really great that we could also be joined by Catherine Smith from SCIE, I was going to say Social Care Institute for Excellence. They recently published, as you say, an excellent commission report on housing with care, and a number of us were very privileged to be part of that, and we really look forward to hearing about how that's going to be taken forward as well. So Catherine, thanks very much, and your opening slide is now on screen.
Fabulous, thank you. Thank you for having me. If we could move straight to the next slide, please. So we launched the commission in October 2020, and this was funded by the Dunhill Medical Trust. And the commission was tasked with developing an evidence-based vision and roadmap for providing more options for housing with care and support for older adults. The commission was co-chaired by the Right Honourable Paul Burstow, who is also SCIE's chair, by Professor Julianne Mayer and by Sir David Pearson, and the commission activities were led by SCIE. The commission considered all forms of housing with care and support, including care homes, extra care, retirement villages, supported living, retirement housing, shared lives and co-housing. But the commission didn't prioritise one form of housing over another, but rather it started from the position that people should have the option to choose the form of housing and support that they need when they need it. And as Stephen just said, that could be a care home for some people, but for others, it might be extra care or another form of housing. But what we were looking for was the fact that a real informed choice should exist. So last month, we saw the launch of the final report of this commission. And as I say, the commission was guided by the 3 co-chairs and advised by a panel of 14 commissioners, which met together 4 times. SCIE acts as a secretariat for the commission and oversaw all of the research and evidence activities. And this group was supported by SCIE's co-production collective. This group is an active part of the delivery team at SCIE and was co-chaired by Dr. Ozzy Stewart and by the Deputy Chief Executive at SCIE, Ewan King. And the group includes people with lived experience of different aspects of social care, including living in residential care and as family members. The work was also informed by a stakeholder reference group. This group had 29 members and was chaired by myself and also by Susan Kerr, the Chief Executive of the Dunhill Medical Trust. And the full stakeholder reference group met twice with additional individual consultation in relation to specific topics. Could we move on to the next slide, please? So the aims of the commission, we had a very strong emphasis on co-production. We've done a lot of work to unlock conversation with diverse groups, including people that access services. And we very much were focused on person-centred approaches to both care and to planning. The reporting of the commission has been very timely, and SCIE, the co-chairs, as well as a number of the commission panel, were all involved in talks with Department of Health and Social Care, the Department of Levelling Up, and with ministers about last week's white paper, in which housing featured heavily and the commission was directly referenced. And our 10-year roadmap sets out how to make some of these policies and ideas a reality. And there was a real positive overlap with aspects of the white paper, providing an opportunity for continued momentum and hopefully real change. Next slide, please. Oh, that's it. So in terms of the Commission's activities, as well as working with the panel of commissioners, the co-production collective and the stakeholder reference group, the Commission drew on the following evidence to inform the roadmap. So we had an online public perception survey of just over 1,500 people, and that was conducted via a YouGov survey. And the full results of that are available, can be found on the Commission website. We developed a cost-benefit tool, which was designed to enable local authority commissioners to explore the financial costs and benefits of developing extra care, residential care and shared lives and sheltered housing. And this tool was developed jointly by SCIE and by Private Public Limited and was steered by an expert challenge group of commissioners, planners, builders and economists. The report, the cost benefit tool and the user guide can also be found on the Commission website. We did a mapping exercise of the housing with care and support sector, which outlined the definitions for each type of housing, as well as information on who lives there, numbers available, who pays, who commissions, and who regulates the services. We developed a directory of promising practice, and this contained 50 examples from across all of the housing types that demonstrate the Commission's 7 principles of excellence, which I will come on to explain shortly. And this included 8 in-depth case studies. And the overview of the sector, the examples and the case studies are also obviously all on the Commission website. We led an appreciative inquiry consisting of online workshops and a series of one-to-one conversations with people with lived experience, carers of people with lived experience, managers, staff and social workers. We did a scoping review of the literature, and then we had a discussion paper which preceded this final report, and that is available to view on the website also. And next slide, please. So we entitled this report A Place We Can Call Home to acknowledge that our vision builds on the social care future inquiry, which was led by people who draw on care and support. And like them, we believe that we all want to live in a place we call home, with the people and things that we love, in communities where we look out for one another, doing the things that matter the most. So I'm going to talk about our vision for housing with care and support and what is needed before giving more detail about the roadmap and how to get there. So the Commission was concerned by the very significant gap in the supply of housing with care and support, and especially for those with intermediate or lower needs. And we want to ensure a good choice of options for all, as well as good information and advice to help people find what is right for them. Next slide, please. One of the immediate priorities outlined on the Commission's roadmap is that local areas should be obliged through new legislation to produce a single place-based plan for housing with care and support for older people, which is shaped by the local authority, the NHS, local planning authorities and local partners, and of course, underlined people who draw on care and support. And we emphasise the urgent need for local areas to be compelled to create a housing plan for older people and for a housing future fund to be made available to local authorities with a clear plan. Next slide, please. So to deliver these plans, the Commission identifies 7 principles of excellence that reflect our compelling vision of the future, as well as existing examples of positive practice that highlight that this can be achieved. These principles should apply across the board to all types of housing with care and support, and that is both existing and new builds. So when local authorities plan and commission, they should be looking to these principles. The Commission presents evidence for the importance of each of these principles, what they should look like, and current examples of promising practice, and where these examples are already being demonstrated. This obviously gives people the opportunity to look at what good can look like to help people to aim to emulate that. So the first one is about person-centred and outcome-focused. So personalised care and support that is outcome-focused, and key outcomes include promoting independence, improving wellbeing and quality of life, and reducing feelings of isolation and loneliness. Secondly, creating a sense of community within housing developments is as important as locating these developments close to the communities. Building community connectedness is also about creating partnerships with local communities, such as local schools, social groups and faith groups, so that people that live there have the regular involvement and interactions with members of the wider community and are able to feel like they're active citizens and that they're involved. Strong leadership and culture is instrumental in providing high quality personalised care for people who draw on support. And leadership starts at the top. Buying from staff is best when they see leaders and managers living the values and visions themselves. And strong leadership also means investing in workforce training and development. Development of skills and capabilities around supporting people with complex and multiple health and social care needs, including dementia or learning disabilities, is particularly important. And then looking at adopting innovation, investment in innovation is recognised, encouraged and facilitated. A key area of innovation is enabling inclusive and accessible housing and garden design that promotes independence. The innovative use of digital technologies across housing with care and support includes innovations in assistive technology, artificial intelligence, self-care apps, wellbeing calls, integrated records of people who draw on support, and wearables, things that people can wear to help to connect them or to receive support when they need it. In terms of enabling choice and control, the key role of services that enable older adults to have more choice and control over where they live and care and support they receive and how they live their lives. The future of housing with care and support must include a shift of power and control to people. Enabling choice and control means having independent and impartial information, advice and advocacy that is clear, specific and local. People of all backgrounds must be supported to both access and live well in housing with care and support. High quality, personalised and accessible housing with care and support should be easy to access for everyone, regardless of their age, ethnicity, gender, sexual orientation or disability. And promoting equality also includes equal access, choice and quality for lower income groups and those in deprived areas. Providing housing with care and support that meets people's needs is only possible if people themselves have been involved in the commissioning, planning and design of housing development and in shaping their own care and support plan. The Commission demonstrates some of the ways in which people who draw on care and on services can be involved in the decisions that affect them. Next slide, please. So then we move on to looking at our roadmap for providing older people with housing and care in the future. In terms of national action, a compelling vision and a strategy for change. The white paper goes some way in this, but there is a need to take that further. The government needs to create a vision and at least a 10-year strategy for housing with care and support. This should be co-produced with older people, their carers and families. It should include a clear and more widely agreed definition of housing with care and support. It should demonstrate how it will tackle injustice and long-standing inequalities in access to housing with care and support. Include a strategy for promoting the right conditions for investment from the private and voluntary sector across the country. Increase investment in intermediate housing with care and support options. Have rights-based legislation which creates legally enforceable standards for housing with care and support. It needs changes to national planning and design codes. It needs a national workforce strategy. And in terms of local action, place-based housing for older people's plans, which we've already discussed, and housing at the heart of community hubs. In terms of longer-term priorities, national action, an annual State of the Nation report setting out what progress has been made. And in terms of local action, scaling innovation and whole place workforce plans. And then my final slide is just for questions, which I think we're coming to afterwards. So I'll stop there and hand over to the next person. Thank you.
Catherine, thanks ever so, and really good overview of a really impressive report. And as you say, some critical actions to take forward, both in terms of testing out some of those assumptions, but also making sure that local health, social care and housing economies partner and co-produce some of those solutions, in particular with people, local people as well, about what those housing. I think that follows on very neatly from what Stephen was setting out in terms of the social care futures and their forthcoming event next week as well, which is going to take a little bit more of a look at this. So thanks very much. And I'm going to pass on now to Catherine, to Jackie. Jackie, thank you very much for joining us and for presenting on this session. Over to you.
Thank you. Will Sally run my slides for me, please?
She will.
Okay.
Yeah, I'll do that on your behalf.
Well, thanks, Jerome.
All right. Thank you.
Just Jackie, just if you let me know when you'd like me to start the video, because I will have to switch between the PowerPoint.
Okay,
thank
lovely. You. All right. So thank you so much, Jeremy, and your team for inviting me to share my views amid such an amazing group of speakers and such a wide audience. My views I share are my own and those of my supporters. And I'd just like to preface my contribution to say that I deal with the reality and I speak as such. I know no other way. So please bear with me as I take you. Are you with me? I'm not hearing.
Yes, we are, Jackie.
Right. Now I'm hearing you. So lovely. So please bear with me as I take you on a bit of a short throwback. As late as the 19th century, the successful exploitation of child labor underpinned Britain's economic success. Children as young as 4 years old were employed in production factories and coal mines, working shifts as long as 12 hours in dangerous and often fatal conditions, crawling through tunnels too narrow and low for adults. Karl Marx was an outspoken opponent of child labor, saying British industries could but live by sucking blood, and the children's blood too. Before 1822, when a woman got married, every penny of her wealth was passed to her husband. If she worked after marriage, her earnings also belonged to her husband. The Matrimonial Causes Act of 1857 gave men the right to divorce their wives on the grounds of adultery. The woman, however, could not obtain a divorce on the same grounds. And once divorced, the children became the man's property, and the mother could be prevented from seeing her children. In 1533, during the reign of King Henry VIII, Parliament passed an act that made male homosexuality a target for prosecution. Convictions were punishable by death. The passing of the Offences Against the Person Act in 1861 abolished the death penalty, but replaced it with a minimum term of 10 years imprisonment. Early punishments ranged from fines, imprisonment in houses of correction with and without hard labor, hanging, and pillory. No one was exempt, and infamously, Alan Turing was chemically castrated and posthumously pardoned for his crime. Britain's central role in 500 years of slave labor was often dissolved with a bitter pill into the much more palatable tonic of the nation's role in the story of abolition. Slavery was abolished by the Slavery Abolition Act in 1833. Most slaves were freed, with exceptions and delays provided for by the English India Company, Ceylon, and St. Helena. These exemptions were eliminated in 1843, 10 years later. We look back on these eras, practices, social norms, and legislation with disbelief and judge them as ignorant, uncivil, lacking in knowledge and understanding, do we not? My point in all of this is that these were all socially sanctioned, legitimized, and embraced for economic profits generated for individuals and the state. Nowadays, we lay claim to a far more civilized way of life in the 21st century. We acclaim modern medicine, technology, space exploration, and a library where every piece of knowledge known to mankind is accessible. That's the World Wide Web. Yet, our eyes remain wide shut. We live with a relic of the 19th century, fully accepting of its failures and wholly ignorant of its irrelevance to the world we live in today. Its foundations were laid in 1834 when the state allegedly recognized its responsibilities to the sick, the poor, and the old with the advent of the Poor Laws. That relic is the existing model of long-term care, institutionalization, which has cost so many staff and users their lives before their time and continues to cause untold pain and suffering for people, family, and the workforce. I stand as an outspoken opponent of the system, and I say that we too will be judged by future generations as we have judged our forebearers. I believe there is no place for it in 2021 and going forward. We explore the stars. We have discovered graphene. We have exoskeletons capable of allowing a soldier to carry 3 times his body weight. I refuse to accept that we cannot make it so that people live out their lives and die in their own homes, regardless of their medical conditions. The Department of Health and Social Care's white paper includes an agenda for a £30 million innovative models of care program, which it claims will work for a changing population with more options for people that suit their needs and circumstances. It will not work. Not in the face of an entrenched, unrelenting systems failure with respect to lifestyle choices, living and dying in the later stages of life. It does not serve us to ignore the gaps and the issues that plague the system whilst we espouse big ideals. On this basis, in September 2020, I founded Jackie's Revolution with the support of 7 brave and courageous people who were willing to put their heads above the parapet and stand with me. I called them my tribe. Can you please run the video now for me, please?
Yes.
Jerome,
Just bear with me a
Thank
couple
you.
of seconds. Sorry, I need to start that again. There we go.
Maya Angelou once said that there's no agony like bearing an untold story inside you, and I will share my story with you today. We have a social problem in this country, one we refuse to acknowledge or accept or address. And that problem is the systematic warehousing of our citizens in institutions on the basis of their age and health needs. The foundation of this practice was laid in 1834, 1 year after Britain officially abolished slavery. As a society, we have come so far in terms of race, sexual orientation, and gender equality. Yet, this bastion of inequality in terms of age remains largely unchanged, but more importantly, unchallenged. We have created a system characterized by the unrelenting suffering of many, grateful acceptance by some, and huge profits for a few. Many dedicated healthcare professionals have left the system because they were so shocked and disillusioned by the way it really works when you get under the hood. You most likely know very little of the underworld of which I speak, except through investigative television programs. Do not think for one moment that what you saw were exceptions to the rule. They were not. All of us, regardless of our differences, are united by one thread: old age. We will all advance in years. No one is exempt. It's part of our life cycle. Do you want to be the product instead of the customer? Do you want to be lost along a corridor with no one to love, nothing to live for, and nothing to do? Do you want to simply exist with no one knowing what is happening to you behind an iron cloak of concealment? I don't. I want to live to the fullest until my last breath. I want to choose where I live and where I die. To each and every one of you, I say, I have seen what lies beneath that cloak of concealment. Trust me, you do not want to be there. On behalf of our future selves, we have it in our power to change course, to dispel the fear of growing older, and to live out our lives as whole human beings. In the words of Amanda Gorman, for there is always light if we are only brave enough to see it. If only we are brave enough to be it. I ask you to join me and my friends to be bold, to be brave, and to be this revolution. Thank you. Jackie's Revolution is a movement with the primary intention of positioning the current system of long-term care as fundamentally socially, economically, and morally dysfunctional in the public domain. The vision is that in the next 20 years, growing older must not cost any of us, anybody, what it means to be human. We believe the existing systems are not fit for purpose. They are archaic and in some instances inhumane. We live in the 21st century. There is no excuse to prop up a 19th century construct that does not reflect the advances of modern society, that is not something we want for ourselves, and which is not a fulcrum for innovation. We believe that people growing older is not a challenge to society and the National Health Service. Society and the failings of the public services are the challenges to people as they grow older. We believe the power to decide where and how we live and die in advanced life must lie with the individuals and their advocates. It is not the right of the state or its agents. And we aim to influence and stimulate public demand for system and social change by winning hearts and minds. We will work with policymakers, innovation agencies, and genuinely committed people and organizations who want to rethink, innovate, and roadmap potential system changes and new ways. We cannot do this alone. To create a system change and a paradigm shift, we must eschew the rhetoric. We need to recognize every sector has a place at the table. Housing, terrestrial space applications, robotics, logistics, the police service, advanced materials, Formula One racing, everybody has a place. The knowledge, technologies, and cultures of people in these sectors need to be brought to bear. I couldn't agree more with Jeremy's statement that the challenge now is to apply these high-level ambitions to ensure that the sector explicitly has the right leadership, tools, and resources to innovate and deliver the quality and range of housing and care choices that people want in the right home. Our homes. It's the place where it begins. It's the place that we treasure. It's the place where most of us want it to end. As a sector, I cannot underscore your capability to engender and be one of the game changers. No amount of investment can override lack of vision, the token gestures of political will, crippling risk aversion, innovation apathy, lack of imagination, and the burden of self-serving leadership. When I hear our leaders and organizations charged with investing in our future selves say they are launching challenges to keep us in our own homes for longer, I feel strongly 'tis no challenge at all. It is a tacit endorsement of the 19th century model of care that one day our homes, our houses will no longer be our home or our house. It is an admission of failure in wanting to do something significant that no one else is prepared to take the risk to do. It is a failure of the spirit of true innovation, and it is an indictment to our society and leaders. I call on this sector, somebody among you out there hearing my voice, I call on you to have the audacity, because it is with your sector that this revolution will begin. For me, every decision about housing and care is a decision about a life. It is a decision about a heart, an identity, and a soul. It is a decision about your life and mine. Thank you for listening.
Jackie, thanks very much. That's really powerful and thought-provoking, as Bob has just posted in the chat box. But also, what strikes me is what's at the heart of what you're saying is very much based on human rights And I think we can all sign up to that. It's very much around what Stephen talked about and Catherine talked about before you, around how we look at social justice, tackling those inequalities, using the leverages and white papers that we have, but also more importantly, how can we ensure that we have a rights-based approach as well. So I'm sure there'll be questions and questions and comments that you posted, and let's harness some of your revolutionary thinking to taking this agenda forward. You also cited a number of things that reflected the evolution of where we've got to and some of the real challenges that we as a country face. And I'm delighted that we're joined now by Una Goldsworthy from Bristol. I think it's a year and a half ago today that the Edward Colston statue was toppled in Bristol, and that caused a lot of interest and controversy as well as passion amongst the local community. But also there's a very clear delivery of housing care and support for many older and vulnerable adults across the city. So Una, without further ado, I'm going to hand over to you. Thank you.
Thank you. And thanks everyone, good afternoon. Jackie, we didn't rehearse this, did we, in advance, what you were going to say and then what I was going to follow. In fact, I was meant to be before you. So you've given me a challenge. I'm going to try and respond to it in some way as well. But actually, I think some of the things I want to say do respond to it, actually. So I was really interested in what you were saying and furiously trying to think about how we did respond, because it resonated a lot, what you were saying. So thank you. A little bit about Brunel Care. So that's the next slide, please. We're a not-for-profit on a day when Panorama are doing the expose tonight on for-profit. I feel that's quite important to say. So we're a charity, we're 80 years old, and we provide housing right across the board and care for everyone from people's own homes right through to support, independent living, reablement and extra care and so on in care homes. So pretty much the whole spectrum of what you might expect to be the provision for older people. And our strap line is later living that makes the most of every moment. And I do think that reflects back to what Jackie was just talking about, because we reflected on this earlier this year. We came up with our new strategic plan, and actually that was the thing that we could all agree on, that it's really about making a difference in every moment, because it's about that quality of life, absolutely about being person-centered, absolutely about human rights, but that it's about every moment making a difference. Wherever you live, whether it's in a care home or whether it's in the community or whatever, that moment is important to be cherished. Next slide, please. And it also made us reflect, I think, that, and we've copied a statement, a slogan from the environmental movement, which is about think global, act local. And that's come about as a frustration from expecting an answer to come hurtling down the M4. It's not going to happen. It's just not going to happen. And I think we've woken up to that realization that just expecting something to come out from government on a national level, we could be waiting forever, and we just don't have time. So we just want to get on with it. That's about us coming, I was going to say out of COVID, but of course we can't say that, can we? So for an organisation like ours, when we have so many care homes and extra care, we are still really suffering and still really in the midst of COVID. It is not over at all for us. We've still got some care homes shut. We've got some extra care where we've sadly had quite a lot of cases in the last week. So it's a dynamic that's absolutely still with us. And that's been really, really hard, as it is for many other people listening today, I'm sure. But one thing that has come out of the last 20 odd months is collaboration, which has enabled us to build a platform which we can now start to think about innovation. And that collaboration wasn't there before. So collaboration both within the health and social care sector, but beyond that too, in terms of other partners. The collaboration has been, for me personally, a massive support. So when you really have those worst days and the worst weeks and you really don't know what to do, there's somebody else to talk to out there, somebody else to share it with. And from that trust that gets built up from that collaboration, there is a space that allows us to think about doing things differently and to trust each other sufficiently. And when I say others, I mean other care providers, I mean the local authorities, the clinical commissioning groups, the hospitals, everybody, and the residents that who live in our homes as well. And so really building on a spirit of trust. And what we want to develop is that community pathway provision. And actually the pathway, when it looks like it sort of ends at the end of a road, is not what we're talking about. It's a pathway that weaves around, and you might need one bit of support for a bit, and then you might not. You might come out of hospital and need some intensive support and then not need it anymore. So it's understanding that that pathway is not just about us as a care provider and a housing association, but is actually about the whole community stepping up and becoming involved in that care and support. Some things I think that are coming out of the integrated care systems. We have quite an unusual system actually in the Bristol area. I don't know if it's happening elsewhere, but there has been a recognition that care providers will be involved in those integrated care partnerships and system. So I sit on one of them in Bristol, and I have to say it's really interesting because it's a whole collection of different organisations, NHS, local authorities, housing associations, local residents, all sorts of different people. And we're starting to answer back to the system and actually say, actually, we don't like this model. And this very health-dominated model of care, actually, we want to look at a different model and a different model of social care that doesn't fit within the constraints that we've all worked in before. So it's a bit like the revolution, I think, that Jackie was explaining. We're actually saying, hang on a minute, actually, no, that's not what we want. We want something a bit different. And out of that is coming is that we're arriving at a conversation across the whole of Bristol, across the whole of the city, and actually to the local authorities around it as well, which is saying we want to talk about prevention. So absolutely, we've got to invest in that prevention. And the conversation about what happens in the health and social care system isn't just down to health and social care providers. So next Monday, we've got a bit of an experiment, and we're pulling together organisations, institutions from the universities, I think the fire brigade are coming, the police, housing providers, we've got social care providers, we've got the bus company, all sorts of different people to say, look, we've got this issue, we've got this problem, but it's not our problem, it's not our issue, it's actually the whole cities and how we respond to it. And I'll let you know what happens, but we've already got quite a lot of interesting ideas coming through. And some of those, I'll skip over, I'll come back to home care versus care home. Some of those come from that vision that we've all got in our heads about the ambulances queuing at the front of hospitals, and that not being good for any community, not being good for any of us in terms of being taxpayers or whatever. And so the whole movement around discharge to assess, seeing that's something that we can contribute towards in lots of little different ways. So we've set up in our extra care homes, we've allocated a certain number of flats that are immediately available to help people move out of hospital while they transition back to their own home if that's where they want to go. We've also set up space within our care homes to enable people to move out of hospital who just need that transition again, either back onto another care home or perhaps back into their own homes. And that could be very specialist around physiotherapy, occupational therapy, or practical adaptations that need to happen in their home. And in a care setting, you're much more able to do some of that really in-depth work around activities and mobilisation, which get people fit again. And from that, we've actually had people who've moved out of hospital, may have been in hospital for 3 months, couldn't walk, and have walked out of where, you know, our reablement centres and needed a much lower level of social care when they move out. So there's some really sort of good evidence around this. And I think that's why I come back to my previous point, which is around, I think there's a real dichotomy about home care, good. If you stay in your own home and you're independent, that's great. But a care home or some sort of care facility is bad. And, you know, I probably would have thought that before I started this job 2 years ago, but I don't now. And that's borne out by my experience of visiting many of our care homes where people they don't just get care, they get love, and they get cuddles, and they get activities, and some of that really profound loneliness that people experience when they have nobody coming into their home. And I've shadowed in the last year, so I shadow in our care homes and I've done shadowing at home care. And I tell you, I come away sadder from some of my home care visits than I do from some of the care home visits. So I don't think it's a binary choice, and it's much more important to think about what that person needs and a very person-centered approach. Next slide, please. This is just some of the headings, and Stephen talked us through these, so I won't go through it, but this is some of the headings from the white paper last week, and it's almost like you can't argue with it. It's really quite good. You know, the person-centered, no problem. Absolutely, be not banging on about it forever. Housing integration with health, adaptations, yet we need more money, and so on and so on. So I can't argue with the sentiment. I think it's absolutely, you know, what we need to do. But next slide. Commissioning. So it's about the commissioning of those services, which really does need to catch up. We are still being commissioned for 15-minute visits in homes. Now, I think probably most of you thought that had ended, and probably Stephen will think you thought that had ended, but it is still happening for personal care. I think most local authorities don't want it. Most local authorities directors, and Stephen probably included, would say it's just not acceptable anymore, but it is still happening, and it's happening because local authorities are absolutely starved of that funding, and are having to make really, really difficult choices. I think the other issue is around the integration with care. The integration with care and housing and support is that the funding of that has got to be realigned. So at the moment, the main funder for social housing is Homes England, and actually their model of housing is it's all about new provision. So if you want to look at remodeling an existing care provision into something that's a bit more innovative, you can't get new funding for it, or you can only get funding for a net increase of homes. And I think they recognise that's a problem with that, but at the moment we're a bit stuck. And then finally, two other bits about workforce, you know, unless we sort out the workforce issues, unless we sort this out, or unless we have a better plan and framework to work beyond that, then we really are stuck. You know, I had pretty much from March 20 till April 21, every weekend I would get calls because of the staff shortages or outbreaks. And then we had a bit of a sort of hiatus and it stopped, and it started again this weekend, where we have care homes with no nurses, you know, and that's an incredible burden. That's an incredible concern and worry that you can be in a situation. It doesn't happen in hospitals because there's always somebody around. But in a care home, you've really got an extra care. You've got that real vulnerability about having sufficient staff turning up. And that's after having exhausted every single agency you can possibly ever think of. And then funding, we all know about funding. So I'm going to end, though, on a bit more of a positive note. And my next slide is some ideas that we're working on at Brunel Care. So this is your typical example of sheltered housing, very much a sort of 1960s concept. These are Brunel Cares. I am not proud of them. I'm being very brave showing you them today. These are schemes that I'm really not proud of. They're past their useful life. They're past a model of what is actually what people want these days. Because of a housing crisis, people will live there, but it doesn't mean it's right. They're often small. In terms of zero carbon, forget it. They're probably one end, you know, completely one end of the spectrum beyond modelling to actually improve them. So, next slide. What we're looking at is a concept of extra care light, accepting that an extra care or retirement village is not possible in every location, but where we've got those sheltered schemes, what can we do to redevelop them around a hub? And that might be a retirement village, or it could be an extra care scheme. This is one of our extra care schemes, which I am quite proud of. You can be flexible with them. They don't all have to be for older people. I love the idea. I don't want to live in an older person's only scheme later on, but I would like to live in a mixed use and a mixed tenure and mixed community. Those connections with your local community are absolutely important. And it's something you can do in extra care. You've got the space, you can bring people in and you can have activities. Subject to Omricom, the next couple of weeks are quite mad in extra care. Last week we had a Elvis impersonator let us down and we had to do a call out for Elvis. That's what goes on. I mean, that's how, you know, how full of life they are. And they're also amazing because an extra care, which is attached to a extra care light scheme, can recruit care locally. And it's much, much easier to recruit people where they can walk to work. You're really working in a local community. They don't have to have a car. They've got a connection. They can meet up with other people. They're part of a team. There's a solidarity and a support that comes from that teamwork, which is really important. And just finally, I think just by ending it, you know, when Jackie was talking about innovation, well, we just don't have all the answers ourselves. And so I hope that I'm humble enough to think that the partnership approach is the key. And there are people who really are seeing what's going on in our space at the moment, who do want to help, who do have ideas. We've got amazing universities, we're just about to hear from one, aren't we? We've got amazing thought and younger people thinking about these ideas. So let's really not think that it's us to come up with all the solutions. We don't have them, and that partnership approach is key to that. So thank you.
Una, thanks ever so, and we'll ask for any questions, and please do post your questions in the Q&A box. We'll come back to that shortly. That was a really great overview, a really honest account, I think, of how it really is. And I know I was very privileged not too long ago to come down to the Reablement Unit and celebrate some of the successes as well. It was great to celebrate Brunel Care's birthday with you. So I do know from first hand what a great work that you and the staff are doing, and that's replicated up and down the country by a number of other associations as well, and care organisations too, obviously. Our final speaker this afternoon, before we do go into Q&A, and that's no pressure at all, John, is John Glasby, Professor John Glasby, somebody who knows integrated care systems, partnerships inside out. Worked very closely with John at the Department of Health and advisor, do a lot of those programs. So John, delighted you could be with us. Not only that, to also draw attention to a wonderful new research project that you've got in partnership, which we're going to hear a little bit more about, called Impact. So over to you.
Thanks very much indeed, Jeremy, and thanks for inviting me to be part of today's event. And yes, I'm here as Director of Impact, the new Centre for implementing evidence in adult social care, but also in my day job at the University of Birmingham, where I'm a Professor of health and social care, and spend a lot of my time, as Jeremy said, thinking about how we collaborate across traditional organisational and professional boundaries. And it's a slightly unusual place to start, but I wanted to just to try and put some of today's debate in context a little bit by going back to the Beveridge report in 1942 on social insurance and allied services. Now, when the Beveridge report came out, ordinary members of the public queued around the block in order to buy a copy. I don't know if that happens where you lived when the white paper came out last week, but in 1942 we were all on the street queuing up to buy a copy of the Beveridge report. We were still at war, so we flew in copies for soldiers who were serving overseas. We made $5,000 from America, who bought a number of copies because they saw it as an international example of good practice in terms of welfare reform. Beveridge himself was seen as a national hero and invited to dine with the king and the Russian ambassador and to speak at events at charities and trade unions and church groups and universities across the country. It's even said that on a Clapham omnibus, a conductor who saw a passenger with a copy of the Beveridge report under his arm wouldn't let the passenger onto the bus until he promised to lend the conductor his copy of Beveridge so that the conductor too could read it in the original. More than any other document before or since, it's something that's fundamentally changed the nature of welfare services in this country in a way that recent policy has probably struggled to do. Now, one of the things that Beveridge identified early on and very famously was 5 giants or serious social problems that a post-war welfare state was going to tackle. In a face-to-face session, I'd embarrass everyone by seeing if anyone can remember any of the 5 giants, but I'll run through it just very quickly. And whenever I'm put on the spot, I can never quite remember all 5 either. So we've come up with a pictorial reminder in case you're ever asked. Again, we've got the giant of want or of poverty. This is Oliver Twist famously asking for some more. We've got the giant of disease. We've got the giant of idleness. We've got the giant of ignorance. And then a slightly older slide, we've got the giant of squalor. And this is Wayne and Waynetta Slob smoking a fag. Or if you need a mental image to try and remember all 5, I've tended to use this one. Now, those kind of things, that kind of language is very dated. We wouldn't call those kind of things now. And in many cases, it's quite offensive. But I think I'd argue that many of the responses we identified in the 1940s are still with us, as are many of the structures that we set up. So want in 1940s language becomes poverty or social exclusion. And we've often responded through the social security system. Disease has been the responsibility of the health service. And although we criticise the health service for not being a health service, for being a sickness service, if you remember that it came out of this 1940s desire to tackle the giant of disease, then that makes more sense. So-called ignorance we've dealt with through education and lifelong learning. So-called idleness we've tended to respond to through employment, sometimes recognising that people need access to meaningful leisure and recreation as well, but often focusing on employment. And then so-called squalor has been the responsibility of housing and of regeneration more generally. And one of the interesting things for me as a former social worker is I've never quite been sure where social care and social work fit into that slide. I don't know if they respond to a sixth giant that Beveridge didn't identify in 1942. I don't know if they're some kind of crisis service that meets the gaps between those other 5 services, or whether there's some sort of glue that hold the rest of the system together. But for me, part of the reason why at a national level social care has sometimes struggled to articulate its role and contribution in a really clear and confident way is partly because it's quite hard to do that against the backdrop on this slide. Now, arising out of that report, we end up with a series of government departments responsible for each giant in isolation, and they'd often have a kind of a regional tier and then a local delivery tier as well. And the nature of the relationships between those services changes over time, and the balance between the local, the regional and the national changes over time. But if you drew our system at any stage over the last 70 years, and I've just started to do health and housing on the slide as an example, you'd end up with something that looked a bit like this. It's very neat, it's very boxed, it's very linear, it's very top down. And of course, we've learned the hard way ever since that it bears no relation to how most people actually live their lives. Real life is just more complicated and more messy than some of the structures that we create in our welfare systems. And probably since the late 90s in particular, but to some extent since the 70s, I'd argue, we've been trying to create something different, something where the person who in this slide is now a citizen in the middle, with the other services fitting in around the needs and requirements of the individual, rather than the other way round, the individual meant to fit into the needs and requirements of different agencies. The language has changed. It's been partnership working or joined up care or integrated care or seamless services or joined up solutions to joined up problems or bringing down the Berlin Wall between health and social care. But the aspiration is still the same, the person in the middle with the services fitting in around the needs and the requirements and the complexity of ordinary lives. The difficulty, and one of the reasons for today's discussion, I guess, is that pretty much everything that we've inherited still looks and feels like the previous slide. Different legal frameworks, different organizational frameworks, different budgets, different IT systems, different geographical areas, different ways of training and educating frontline professionals, different approaches to whether things are universal and free or targeted and means tested, and so on and so on and so on. Pretty much everything that we've inherited looks and feels like that top-down silo-based slide. And yet people on the call are being asked to take that very divided history and to turn it into something that looks and feels on the needs of the individual. And if that sometimes feels very difficult and frustrating, it's basically because it is. I don't think policymakers realise sometimes the complexity of the task that we've been set. But there's quite a famous article on the 5 laws of integration, one of which is that you can't integrate a square peg into a round hole. And the reality of today's conversation is we're being asked to integrate a square peg into a round hole. That's just the nature of the challenge. Now, what I wanted to do just before I finished and through open to questions and discussion was to look a little bit at the evidence base. And I come to this thinking about the relationship between care and housing as a former social worker and indeed as a former care worker, as well as in my university role. And there were 3 experiences that were really pivotal to me early on in my training. When I arrived in my statutory placement, I was in an inner city area office, and there was a housing department on the 2nd floor, and adult care was on the 3rd floor of the building. And I was really chuffed that housing and care were in the same office, covering the same patch of the city, and wondered if that would help me as a student understand the city in more detail, but also work with other professions and learn more about collaboration. And it became really apparent from day one that although we shared a building, there was nothing in common between the two floors of the building, if you like. Nobody ever spoke to each other or came into contact with each other, despite working for the same local authority and despite being in the same building and despite covering the same geographical area. And my first ever case actually was a person of working age with a head injury and substance misuse problems, who'd been referred through by people in the tower block where he lived because they felt that he was struggling to cope. And then later on, because of a smell that was emanating from his flat. We hadn't had the capacity to respond, and it got given to a student, and I took on the case. And to fast forward to the end, basically he'd been dead in the flat by himself all that time without anybody noticing, other than the neighbours reporting the smell. And the only time I ever met the housing worker was when we turned up together at the tower block in order to sort of initiate the process that led to his door being kicked in for him to be discovered. Later on, I remember going with a colleague to look around someone's house while they were in hospital awaiting discharge, and they'd really struggled to maintain the property. It was in quite a distressing state. And there was a policy locally that if things were really unclean, then it was social services responsibilities to hire in an agency to clean it up. But if it was infested with something, then it was an environmental health issue and housing paid for it. So they used to send a social worker in to check whether there were rats, in which case it was environmental health, or whether there weren't rats, in which case we were responsible for cleaning up the house. And just remember as a student thinking, I'm not sure this is a really good way of organising the different skills and perspectives that we have to meet people's needs in a more holistic way. And then finally, I remember working with an older person who was quite frail and unwell herself, looking after a teenage grandson who had become addicted to heroin as part of a kind of local gang that got young people addicted to drugs and then used them to sort of carry on the criminal activity in quite a tough part of the city. And they were living together in effectively a one-room bedsit in quite a tough neighborhood on the ground floor. He was sleeping on the floor and she was sleeping on the sofa, and the place was incredibly damp. She got really a bad chest and breathing difficulties and was trying to get rehoused so she could better care for her grandson, but also because of her own health. And again, no real joining up of the housing input, the social care input, and indeed trying to get a letter from her GP to get rehoused or to get extra ammunition to help with her rehousing. And I still to this day remember actually the GP surgery not being prepared to support the application unless she paid a £25 fee for the letter from the GP service in order to then go to the Housing Association to see if they could find her something better. And so we had a whip around in the office to cover the £25 that she couldn't afford, and so on and so forth. So those were early experiences when I was training as a social worker. I'd like to think they're a long time ago and that things would be different now, but I wonder to what extent things have moved on sometimes. But all the formal evidence around joint working and collaboration across agency boundaries says to me 3 or 4 things. First of all, it says to be wary of structural solutions, particularly when it comes to the relationship between health and social care. There's a temptation in policy circles to want to integrate different services. And of course, we've had structurally integrated health and social care in places like Northern Ireland since the 1970s, without that structural integration leading to frontline service delivery feeling any more integrated to me than in a non-structurally integrated health and social care community. Structural solutions can look big, bold. It can look as if you're sweeping away the old and ushering the new, but often it makes things worse rather than better in the short term. And in some parts of our public services, particularly the health service, we reorganise our structures so often that things are only just getting back to where they were before we then start that process again. And one of my colleagues slightly unkindly described the NHS as an organisational shanty town, where we hastily cobble together our structures and nobody bothers to do it too carefully because they know that in 6 months the bulldozers will come and displace us somewhere else. And I have to say, I see a degree of history repeating itself in the health service at least. So whatever the future looks like, I think it looks like the partnership and the collaboration that Una and others described. I don't think it looks like a structural solution in inverted commas. What does seem to really help is focusing on outcomes. And as many speakers have said, outcomes that matter to people. That may seem really basic, but in public services, we tend to focus more on processes and structures, or even when we start to talk about outcomes, we get dragged back into a debate about processes and structures, often by some of the inspection and registration systems that we have to work with and by elements of policy. What can work better is rather than jumping straight into a debate, if you like, about, well, what do we do? What do we set up? What would you call it if you drew it on an organizational chart? Where would be the straight line and where would be the dotted line? It's often better to say, well, what are we trying to achieve together? And then to go back from there to, well, how well does the current approach achieve that for people? And I suppose I'd argue if we had a genuinely shared understanding of where we are now and a genuinely shared understanding of where we're trying to get to, very much like the Brookmore example in the Housing Commission that Catherine talked about, then the bit in between, well, what do we do? What do we set up? How do we work together? Ought to become more straightforward. But without that prior debate about outcomes, we can't have a sensible discussion about how we work together or how we collaborate, because the collaboration becomes an end in itself. And I worked with one health and social care community, actually not a housing community, that were adamant that the outcome that they were looking for through their joint working was an integrated management team. This was in older people's services. I've never met an older person that needs an integrated management team. It's just not an outcome. Now, in that example, having an integrated management team is merely a process or a structure that might lead to very different and much better outcomes. But equally, there might be 101 things we could do that might be quicker, cheaper, better, less disruptive. So the second that, in my example, that having an integrated management team becomes an end in itself rather than just a means to an end, then some of our discussion of collaboration and partnership has become part of the problem, probably, rather than part of the solution. What matters most, we've learned, is working with different cultures and values, particularly when it comes to caring professions where our identity and our values are so core to what we do. People often think of collaboration and partnership and integration as being a sort of technical bringing together of issues, when really it's about bringing together different people from different backgrounds who see the world differently. And we find that even the language that people use can be really important in these situations. Often when you have let's say a housing and a care audience, or a health and a social care audience, and we're trying to facilitate conversation and joint working, somebody, often a senior leader, will say, well, what we're trying to do here is create a shared culture. And our research suggests that people mean two different things by a shared culture. One is what we've called a melting pot approach, where you take a social worker, you take a housing worker, you metaphorically melt them down and you recast them as some sort of all singing, all dancing generic professional. And that's often not what we mean when we talk about a shared culture. The other model is what we've described as an orange juice with added vitamin C approach, where you take what's good about a social worker, you take what's good about a nurse, you celebrate it and nurture it, but you also enrich it and broaden it by bringing it into contact with other ways of seeing the world and other ways of doing things. And I think we're often talking about that orange juice with added vitamin C approach to culture and joint working. And then finally, many of the structural solutions that I cautioned against earlier are often very top-down. They're about integrating organisations or budgets or management teams. I wonder whether there's a more bottom-up way of trying to approach this, where we enable people with complex or cross-cutting needs to join up their own care and support in a way that works for them in the context of their own lives, their own relationships and their own communities. A more bottom-up form of collaboration and of joining up care and support, rather than necessarily that more top-down organisational notion of joint working. And of course, if we could get the top down right and we could get the bottom up right and we could find a way of them meeting in the middle, then we might really be motoring. So Jeremy, in a moment, I'll stop sharing my slides if that's okay. I guess just going back to where I started, though, I wanted to say that I think what's at stake here is really, really important. And some of the examples in the chat and in the other presentations have been really inspiring. But if we could get this right, if we could join up care and housing so that every conversation about care was genuinely a conversation about housing and indeed about communities, then going back to where I started with the Beveridge report in 1942, I think we would once again revolutionise welfare services in this country. I think once again we'd be an international example of good practice like we were with the Beveridge report in 1942. But most importantly of all, I think we would end up with care and support and with lives and with communities that were so close to what people wanted and what they needed that we'd get people talking about it again on your equivalent of the Clapham Omnibus. And that for me is the nature of the problem to be solved and the nature of the opportunities going forwards. Jeremy, I'll hand back to you.
John, thanks ever so. A really illuminating presentation, and the Beveridge, obviously, and the work of Bevan around integrating health and housing under one ministry at that time as well. So again, there are a lot of really good links to that. And I'm struck by some of the things you're saying about the culture, but also you mentioned some of the shantyism around there, that a former director of housing and adult social care for a Northeast Northeast local unitary authority drew to my attention that, while he'd been director for 8 or 9 years, he'd had 8 or 9 different chief execs working within the CCGs and the PCGs beforehand. So again, creating a sustainable sort of relationship was also as important to work together to build in a common vision for that locality. But thanks ever so for your presentation and for putting some of those strings together, and even a reference to Lutz's 5 laws of integration, which was very good. Yeah, very good. Okay, we've got a selection of questions in the Q&A box, and also some comments in the chat box. So I'm just going to quickly go to those. And I think Shirley may have left us already, but I was just wondering whether any of you had any thoughts about her thought about the radical rethink, which not only is about some of the care, but also redesigning low-cost, eco-friendly smart homes. And she draws in particular reference to multi-generational communities. Any thoughts? I don't know if Una, if I could throw that to you. Do you have any thoughts on that?
How can I say this? I mean, my background is in housing. We're a housing association, so I would normally, you'd expect me to say, yes, it's all about new forms of provision. But actually the amount of new homes that we're going to create is so tiny compared to the ones we've already got. We also have to think about reimagining the homes we've already got and what we can do around those. So yes, for some people, it's absolutely what they want, that sort of co-living. And we've got, Bristol's very famous for that. We've got quite a few of those. But it isn't what everybody wants, so it's only probably ever going to be quite a marginal solution, I feel.
Yeah, and I think there's an element of that, and also what will be also interesting for us, I suppose, in the LIN is how much the eco-friendly smart bit might be allied to future building regulations as we look at increasing need to address climate change as well. Yeah. So in a sense, we've got the perfect storm of both looking at our quality of housing stock, but also the occupiers and aging occupation as well, to think about that. So again, so I think you're right, but I think perhaps 5, 10, 15 years hence, we also need to build in the building blocks now. Any other comments on that one before I perhaps go to Simon Evans's question? Yes,
Jeremy, if you don't mind, I agree completely with you that there is a real opportunity now if we take the climate change agenda, if we take the challenges of the current housing stock not being fit for purpose. And I can't remember who it was in the chat was talking about the voice of the older person diminishing. And my response back, actually, if you think of people born in the 50s and 60s, they are the target group for politicians. So really we should be encouraging that group of people to exercise that voice really loudly. Maybe I'm saying that because I happen to fall into that group myself, and I'm thinking about how unsuitable my current house is for my needs probably in 10 years time. But it needs to be making changes now not wait till 10 years time. So I think this is a really, hence the importance of this conference, to really start to raise the profile of this conversation. White paper, climate change, etc. There's a lot going for us now if we grasp it.
Thanks, Stephen. Catherine, did you find that through the Commission as well, that through the stakeholder and customer engagement you were referring to, how many people were making it as a last-minute decision or making it a crisis decision, I think, which Stephen's perhaps alluding to, as a thinking of one which is about preventative and a lifestyle choice?
Oh yeah, the majority of people end up having to make that decision at a moment of transition, at a moment of change. It's very rarely a pre-planned decision. And in fact, I just answered one of the questions on the in the box. That's a kind of similar answer, because I think when people, if people were to make decisions ahead for their own future, about their own housing with care as they might need it, we'd probably make very different decisions, but we don't talk about it and we don't think about it. So the time when it becomes the time for you to talk about it is when you and your family have quite often reached crisis point. And the other issue is also about where people get this information from. And quite often people who haven't had access to social care in the past get their information from the GP. And often the GP's first port of call is suggesting a residential or nursing home, which is obviously not, I'm generalising there, but often that's the case. And I think, you know, to go back to the idea of this sort of multi-generational communities really needs us all to start thinking ahead now. What do we want? What does everybody in this conference want? Should we need care and support when we get older? What would that look like? And we need to start making those designs locally for that now.
Yeah, no, that's interesting you should say that, because in the chat there's also been some debates and comments around the work of community catalysts and others. And I know from our own work with Shared Lives Plus as well, there is a start to think about that multi-generational, intergenerational living to support people by providing a wider range of housing choice, sometimes with others who don't have equity, to move in with people who do have equity as well. And often not about a generational divide, but just around sort of creating a much more multi-generational, intergenerational community.
Absolutely.
Yeah. Simon sort of raises an interesting point, which is really quite a philosophical one, about could the entrenched social stigma around ageing and death lie at the heart of the continued refusal to provide decent options for later life housing? It's also reflecting how older people's well-being and liberty has been sacrificed in the interest of the economy during COVID-19. And John, you talked about sort of dependency, and Stephen, you appeared on Ed Balls's really excellent two-nighter. I think it was a week after each other series on the care crisis. So, do either of you have any thoughts about that?
Yeah, I mean, I'll link to what Catherine's just said, if that's okay. So I think my experience is that very few people understand what social care is, or how it's funded, or how it's organised. And of course, it's heavily targeted. So we tend to be aware of more universal services like the health service or like education. So those tend to be better understood, more popular with the public and politically. And it's much harder to make the case for some of the things that we're talking about because of that lack of awareness. I think on top of that, there's an element of societal attitudes to some of the people who draw on care and support. You know, I wonder whether one of the reasons we don't value care and support as much as I think we should is because deep down as a society we don't value some of the people that draw on care and support as much as we should. There's a you know, I think there's something really important there. And then a lot of the things that are involved in care are things that we struggle to confront as a society and as individuals about aging and becoming more frail. Many of the tasks that are involved are things that are quite taboo as well, you know, about going to the toilet and about not being able to dress yourself, and just stuff we don't talk to each other about or don't like to think about that. So because it's targeted rather than universal, because it's quite low status, because it deals with a range of really difficult, quite distressing, quite kind of taboo issues, then people tend not to understand it or know about it or ask about it or think ahead until they're in a crisis. And I agree entirely with Catherine that making a life-changing decision in a crisis is probably quite common, but isn't a good time to be making a decision. And I also agree with her point about, well, where does the advice come from? So just in my day job at the university, or kind of living in the part of Birmingham where I live, I should count it sometime, the amount of my working week that I spend just talking to people who were going through something with a disabled child or with an elderly relative or parent, and don't know how to navigate the system, and kind of come to us because they work at the university or they live locally, and I do what I do for a living. I spend hours just talking to people about how the system works and how to try and navigate it. And I start to wonder, well, how do you navigate it if you don't know a professor of health and social care at a Russell Group University, or if you don't live in the part of Birmingham where I live? I suspect you don't navigate it very well at all if you don't have access to that informal source of support. So I do wonder whether there's something about navigation, about awareness raising, about signposting, about having these kinds of conversations, and having these conversations as individuals and as families and as citizens, not just in our day job. So, me talking about this to my mum and to my neighbour and so on, not in my day job, but just as part of trying to change the culture, I guess.
Yeah, and I think, Stephen, you may have some words around this as well, because obviously you have the CARE Act. The white paper actually puts in a lot around advice and information. So any sort of critical thoughts there?
Yes, indeed, and
constructive thoughts.
Yeah, no, of course. I think the pandemic actually showed an opportunity or a solution to some of this in relation to the role that communities find themselves and chose to undertake, where they stepped forward around the people that were their members, including those, as John described very, very eloquently, who we may often have perhaps walked the other side of the road to avoid, in a sense. But I think there is a need for a much greater public debate around this, because again, I know I'll be criticized for picking this example, but we don't criticize people working, or we don't think of children as they grow up from being very dependent to be independent as being a draw on us. We don't see those first faltering steps as being anything other than exciting and exhilarating and independence orientated. But we do tend to see those faltering steps as we become older as being terrible, as being negative. We do see the fact that we need help with eating, drinking, never mind personal care, as being something to be shunned in a lot. So I think there is a conversation we need to have around society in its broadest sense, but then we need to use the experience of communities as a vehicle for, rather than having to rely on a John Glasby in every community. We have loads of those because people in communities have an interest in the people who live within a 1 mile or 2 mile radius of them. I'm in a more rural part of Worcestershire, John, so it's probably more reasonable than that. You've probably got 200 yards or so in relation to population. But I do think, I'm always interested in having a conversation with the media around adult social care, but it is so interesting and frustrating at times that they want to talk about older people. They don't want to talk about, the 30-year-old who's had a life-changing illness, the person who's had a life-changing accident, the person who has a long-term mental health need that who needs that support to live the life, the ambition, to realize the ambition that I talked about. I've said this before, all of us are one event away from needing that support. It's a road traffic accident, it's a stroke, it's a life-changing diagnosis that would require us to draw upon some of the support here. So, I've been a bit controversial at times because I've said I'm not that interested in the NHS because I don't intend to draw upon it. And people say, oh, you will need the NHS. Well, I'm hoping to be healthy and well for as long as possible. but I do probably intend to draw upon social care as the impact of frailty comes about. So I have a real interest in that. Why can't we get society to be as interested in social care as we have in this country in healthcare, never mind education?
Excellent point. And you know, from a very practical level, I mean, are there challenges that you find? One of the questions we've had, one of the chat boxes, people actually don't understand what things like extra care is or supported living. And as Stephen rightly points out, you know, the white paper is not just about older age adults, it's also about working age adults, including those with complex needs. So any thoughts around what you think about the state of the narrative should be, perhaps?
I think sort of, you know, if we look at what happens in some other countries, it's so much more developed, isn't it? If you look at Australia, New Zealand, even the States, actually there's a much better understanding of what retirement living is. And maybe it's because of the names we give it, extra care, retirement living is probably a bit more understandable. So sometimes it's our own fault as a sector about the terminology that we use as well. I definitely think that nobody really understands about extra care itself. And so there's definitely a messaging we need to get out about that. It is starting to, I think the health authorities are starting to understand that it can be useful for them. And I agree, Stephen, it's really hard, isn't it? Because everything we do, we try to, in order to get attention, we have to frame everything as a health outcome. We have to frame everything about helping the NHS, not social care. So if I want to get, you know, if I want to get some support for a particular initiative or using extra care in a certain way, I have to say, it's going to save the NHS money. You know, and it's just like, that's the narrative I always have to use, and I don't feel comfortable, but I want the outcome, so I have to use it, you know, inevitably. So I think with extra care, there is an understanding, and once people do move into extra care, they just love it. It's fantastic. On Friday was one of our extra care schemes, and I was talking to a couple who are, wait for it, 98 and 97, still married, still living independently. I'm going off on tangents now, but I've got to share this with you. So I said to them, so what's the secret of your long marriage? And she said, I just need to know when to shut up. So I thought that was lovely, but she's still, you know, still living a quality life independent with the care coming to them in the home, and it can notch up and it can notch down, and it's so sort of flexible in its use. But I think there are other models within that we have to, because that sort of works. Extra care in this country works for people who can't afford to buy their own home often, but there's a real barrier about, you know, you can only access it if you've got a certain income or below a certain income. So I think it's a complete minefield. Yeah, definitely.
You may well have answered this, Catherine, but there was a question earlier on about how can local authorities and housing providers work together to better assess needs and plan for provision for all range of housing, including supported housing. The Commission sort of makes out, and I think you hinted at in your presentation, the need for better strategic planning and market assessment. Are there any other things that you think that you would like to see change, perhaps which the social care white paper sets out and can be seen as an encouragement?
Yeah, I mean, absolutely. It is as simple as people working together, but at the moment, housing departments, social services departments have different priorities. There are some local authorities where it is one and the same person, but in many it's not, which means that sometimes the plans are drawn up separately and the priorities are drawn up separately. And of course, there's separate government departments as well under the DHSC and the levelling up, which is why we've tried to influence both to look at this. And actually what this needs is a national strategic plan about housing and care coming together, but also locally, when a local strategic needs assessment is being carried out, it needs to consider the housing and care. And some of this, I have to say, I felt this throughout the white paper. But some of this feels like we've been talking about this for 30 years. It doesn't feel like we're having new conversations. I remember talking about developing multi-generational housing when I worked in local authorities 20 years ago, and you know, and the extra care housing, and having joint strategic needs assessments with each part of the organisation. And in some ways it feels like we don't move on from these conversations. And you know, what the Commission comes out with and what I would endorse is that we need to move them into a plan, and those plans need to be revisited every year and progress against those plans looked at, because actually in most instances the barriers are only ourselves and how we work together. Of course, somebody's mentioned the funding, and is the funding enough? And of course, we're going to say no. And frankly, it didn't matter what figure they put there. We were probably going to say no. But this, as Stephen said in an earlier answer, has to be our opportunity to show what can be achieved, be able to evidence the impact of that, to give us the case for further funding to get this right in the future, which means we've actually got to make this change and do less talking about it and more making it happen. And for me, I think that this has to be an ambition that's not just held in the minds of leaders, it's held in the frontline staff that are doing the delivery, it's held in the communities that they're working with, and we need each department seeing the same thing. And I'm going back on a question slightly, but something that John said really struck a chord with me, because I remember quite a few years ago, I was visiting an elderly neighbour and found that she'd fallen the night before and she'd been stuck overnight on the floor. And we had to break into the house, sorted her out, got her home care, etc., sorted the care package out, made sure she was okay. And I was repeating the story to my mum later. And my mum said to me, "How did you know what to do?" And I said, "What do you mean, how did I know what to do? It's my job." And she went, "Yes, but how would I have known what to do?" She said, "You arrived at this person's house at 8 o'clock on a Sunday morning. How did you know how to sort out her stair lift was broken, how to sort out her home care, how to sort X, Y, and Z out?" And I thought, oh, I don't know the answer to that. I don't know how you would have known that. And the problem isn't just one about accessing the system, it's accessing the systems. Because in fact, all of those different areas that I had to contact were all part of a different system. And until we make the effort and join that up, we're not actually going to come up with the right solutions either.
Thank you. That's a really powerful message for us to end on, because not only will we not get the right solutions, but we could also exacerbate the inequalities that are out there, and even some of the challenges that Jackie threw at us around the discrimination and disadvantage people experience. And Stephen even alluded to some of that through COVID as well for many vulnerable groups in the community. I'm just going to say, are there any final words from our fantastic speakers and panelists? Because I'm going to have to draw this to a close. It's been a great session. No? Well, on behalf of the HousingLIN, can I thank each of you for your excellent presentations and for helping us to kickstart day one of the HousingLIN Summit. If you're interested in some of these issues that we've been highlighting during the course of the day, but in particular in this afternoon sessions, we've got a flavour of these to build on tomorrow, where tomorrow morning we've got a session looking at how to reimagine sheltered housing, perhaps to help Una to think about some of those hard to let properties. Well, they may not be hard to let, but they need retrofitting for sure. And tomorrow afternoon we will be putting a showcase on to look at some of the more innovative solutions coming through another Dunhill Medical Trust funded project, the TAPI project. So can I just thank all our speakers again? I'm sure if you could hear the claps, you could hear us applauding you. And can I also thank the HousingLIN team behind the scenes for making this such a smooth running session. Thanks everybody, and have a good evening.